Hello and welcome to this British Psychological Society audio interview. I'm Wendy Barnaby and I'm joined by Dr Kathryn Rouf, who's a clinical psychologist working at the Oxford NHS Foundation Trust. Now Kaj, I know that your main work is in adult mental health, but you have been doing some research into living with severe food allergy. Why have you been researching something so far from your normal work?
The research was with a colleague of mine, Kathryn Evans, and also Dr Loretta White, and it came about because I'm a mother of a child with a food allergy that was diagnosed when he was very small. And so I'm coming at this from the point of view of being a mum, as well as a psychologist. And it struck me that there wasn't a huge amount of information out there for parents, and I felt quite lost. My colleague Kathryn is also a mother of a child with a severe food allergy. And we wanted to kind of explore whether there were common experiences for other parents in this position.
It sounds as though food allergy is not just a medical condition that affects the person with the allergy. It's a much broader thing then that affects parents and presumably all the members of the family. What have you found so far as a result of the research?
I think the three main things that we found were that parents really needed time to adjust to what had happened. Some people were describing kind of feelings of shock. Some people had been quite traumatised by seeing their child have a very severe allergic reaction, and it took time for them to get back on an even keel and to adjust to what it means to have a child with an allergy. The second thing that we noticed was that mums were saying that it was a big responsibility. It felt like a big responsibility to live with risk and how to manage that for themselves and for their children. And there was something about trying to not be overly cautious and overly protective, but also not underplaying allergy. And I think one of the things that can feel difficult is that people have such different perceptions in the public about what an allergic reaction is, and that can range from people thinking it's a very mild reaction that would mean itchy skin and a bit of an upset tummy to very severe anaphylactic shock. And people think that they know what is meant by allergy, but actually for parents who've got children with very severe allergic reactions, it's trying to get across, please take this seriously, and then once you've communicated that, letting the child live a normal life, so as much as is possible. So there's a really kind of fine balance to be struck in terms of getting that across. The third theme that came up from what mums were telling us was thinking about social integration, really, thinking about identity. One of the participants came up with a lovely quote, which I always remember. And she was trying to say, look, my child is a normal boy with an allergy, not an allergy that happens to be a boy. And I just thought that captured it so beautifully. And I think, you know, having confidence that other people are around the child in their friendships at school, teachers, family, carers, all the people that a child would come into contact with, treating them as normally as possible. Because actually, if children are away from the allergen and it's managed appropriately, they're well.
I can understand how stressful it must be for parents, but does it have any particular effect on the child? Because the child presumably has to take responsibility when they're a certain age for their own health.
There's talk of there being an appropriate level of anxiety. Actually, you need some anxiety to be able to manage your condition well, but it's about the kind of level of it and keeping it proportionate. So it's important to be cautious and to remember to carry one's medical kit and to understand the seriousness of the condition, but for that not to become debilitating. I think that, you know, over a course of a child's life, there are developmental issues there. You know, a child of 2 is not going to be able to manage their own medical condition. But as they get older, one of the things that is a theme is letting go. Parents letting that responsibility be transferred across to their child and them needing to take more responsibility. And again, I think, you know, Kathryn, Loretta and I were really keen to encourage other psychologists and a debate within the public about how can we improve and expand our services to people with allergy. So again, that it's not just about the biology, it's about helping parents to have those conversations with their child about the seriousness of an allergic reaction, because that's quite difficult. It's quite upsetting to have a conversation with a child about, actually, if you come into contact with this could make you so poorly you could die. And also to kind of be confident to refuse food. And using an example from my own family, you know, we've often done role plays about how to politely decline certain foods at a party, what words to use to kind of explain I have an allergy, and also to kind of hand over more responsibility around carrying a medical kit around and impressing on my child about how important that is.
What's been the best of it and the worst of it for you as the mother of a little boy with food allergy?
I suppose that in the beginning, the worst of it was suddenly being sort of catapulted into this world where I wasn't sure what was going on with my child's health, and witnessing him being very ill on a couple of occasions. That was really difficult. And then just not feeling that I had enough of a network around me to know whether what I was experiencing was, in quotes, normal, typical, and some top tips for how to manage. My son's nearly 13 now, and I'm very proud of him. I think he manages very well. I think he's living as normal as life as is possible. He's a very typical preteen. And it's lovely to be at this point, and I feel much more confident about managing his allergy, managing things like travelling, parties, social events, because food's everywhere. Food, glorious food, you know, it's part of our kind of cultural fabric. But I just feel more geared up. And I'm feeling confident that he's learning those skills that will stand him in good stead once, you know, he takes more responsibility as he's getting older now.
Kathryn, thank you very much indeed.